Hi, I'm Dr. Bryan DiMarco here at Renew Dental. We hear a lot of myths and misconceptions from patients about dental care, so I'm here today to address a few of the most common ones and help to give you a better understanding about what actually goes on when you come to the dentist. The first misconception that we hear is, are dental needles very big and painful? So the good news when it comes to needles is that there's been a lot of advancements over the years, and we've gotten to the point where a needle is as nearly as painless as it can be. Good news when you come to the office, the dentists at our office are always going to be using the smallest needle that we can in order to try to reduce the pain during the injection. The other thing that we do is that we will make sure that we use a topical gel on your tissue first, which helps to pre-numb it before the needle so that it's not as uncomfortable going in. And then also our injection techniques, making sure that we're injecting as slow as possible to make it as comfortable for you as we can. So the second thing we hear is the dental implant screw actually huge? So when it comes to a dental implant screw, it's actually often smaller than the roots of your teeth. The dental implant, the diameter of it can vary in size, but it's generally a few millimeters wide. And it's usually a few millimeters wide, and we have ample space on either side to ensure that it's a safe procedure. The thing about dental implants is that we actually do a lot of planning before the procedure itself to ensure that it's safe when we place the dental implant in. So by using 3D x-rays, digital planning software, we can ensure that that implant placement is accurate and safe so that the rest of your teeth stay healthy. Does getting anesthesia always hurt? So when it comes to anesthesia, a lot of the times it does depend on what area we need to numb. There are some areas of the mouth that, yes, are a bit more uncomfortable than others, but for the most part, what we're doing is trying to make it as comfortable as possible by doing things like using that numbing gel to numb the tissues before we inject, using a slow injection rate so that it's as comfortable as possible, and massaging the area so that, again, it's as comfortable as it can be. Is the dentist going to force my mouth wide open for the entire procedure? So when it comes to care at our office, the number one thing is we want to make sure that you're comfortable. So if at any point you feel like your mouth is too wide open or you need a break, you can feel free to stop us at any point so that we can make sure that you're comfortable. The other thing that we do at our office is we use what's called a bite block or a bite pillow, which essentially is a device that you rest your teeth on. And what most patients find is that it's a lot more comfortable for them to get dental treatment done because instead of having to hold their jaw open, they can just bite down on this device, which helps to make it a lot more comfortable. Is dentistry always painful? So when it comes to modern dentistry, we're trying to do everything we can to reduce the amount of discomfort that you have during the procedure. The good news is with the modern anesthetics that we have, we can get you numb so that you're not feeling pain during the procedure. This helps us in terms of the dentist doing your procedure because if you're comfortable, it makes it a lot easier for us to do the procedure. And a lot of the new techniques help to minimize and reduce the pain after the procedure. The other thing, if we are expecting pain after the procedure, is that we can look to prescribe you medication to help to make it as comfortable as possible so that you're not out of action too long after procedures. And lastly, the biggest misconception or question that we get is, if nothing hurts, does that mean that everything is fine? So when it comes to dentistry and teeth, one of the biggest issues is that your teeth are very good at not feeling pain, which is why it generally doesn't hurt when you're chewing. Part of the problem with this, though, is that issues and disease often doesn't hurt when it's in the earlier or smaller stages. Once a disease gets more extensive, that's generally when it gets into that middle part of the tooth and the nerve. And once you're having pain, that generally means that more invasive and other procedures are going to be necessary. So when it comes to dentistry and treating dental disease, coming in for routine cleanings and checkups is going to be the best way that we can identify disease when it's happening before it becomes painful. And a lot of the times when we do that, we can then do a more smaller, simpler procedure that helps us to fix the disease so that you don't have to have it long term. So that's why at Renew Dental, we emphasize focusing on preventative care, such as cleanings and exams and x-rays, so that we can identify these problems early to save you headache in the future. So I hope I was able to answer some of the questions about the myths and misconceptions that are out there about dentistry. If you do have any other questions or you are ready to book an appointment, please feel free to give us a call at 204-817-6768 and we'd be happy to help you.